Hello everyone, I'm Dr. Precious and here we speak about all things health, especially dental health. Today we're going to speak about the 5 things I wish every patient knew before they get veneers. Veneers is very wonderful in the sense that it can brighten your smile overnight. However, there's a little more to it. Some patients that I see don't know or have a clue what to expect. They just know there's something called veneers and they make their smiles to be wonderful. So they walk in, they say, "Can I have veneers?" And sometimes, unfortunately, I have to tell them, no, you are not a candidate for veneers due to several reasons. This video may save you a lot of frustration, a lot of time and money because veneers is very expensive, like we all know, and they can be a lifetime investment. So it's good for you to make an informed decision. Number one, many patients think that veneers is a quick fix, once and you're done. No, veneers can actually be a lifetime commitment. It may require maintenance, it may require replacements, they can break in the future. Sometimes they can stain. Your gum might start receding, showing the way the veneer stopped versus where your root started. And at that point, other things may need to be done to the veneer. So it's good for you to go in having a realistic expectation, knowing that this is something that will require you to maintain long term. It's not you get veneers and you're done. Tip number 2, know if you're a candidate or not. So you won't be surprised when you're told otherwise, or you will think that the dentist just doesn't want to do it. If you have other things going on, like your teeth is crowded, you may not be a candidate for veneers. You may need to fix your bite first, because if you're grinding your teeth at night, you may not be a candidate. A lot of things can happen to make your veneers to break if you put excessive force in them. So before you get veneers, you want to make sure that your teeth is in good alignment and you have healthy teeth. If you have gum disease, it's something you might want to address first. Gingivitis, a lot of things. So before you get veneers, you have to go to the dentist that will do a proper complete check and fix anything that needs to be fixed before the veneers. Tip number 3, veneers can be very expensive. I don't want you to be surprised at the cost maybe down the line after the process is started. Most of the time, veneers is considered a cosmetic procedure, so insurance does not cover it. Transparency is key. Ask your dentist, ask the office exactly how much it is going to cost before you get started. And then look into options. It doesn't mean you can't get it, because there's financing, there are other options that the office may tell you about that you can explore, so you can still get your fantastic smile. So it's important to know about cost of veneers. Tip number 4, know that it's a process. It's not something you can just go into the office and boom, you have your smile, you have your veneers and you're done. It's a process. It takes a lot of fitting, it takes a lot of work. Sometimes things might be redone to make sure you get the best out of it. There is the time to prep, there is the time to take impression, there is the time to sit the veneers. All this may be multiple appointments. It's good for you to know the time investment so you're not surprised about it when you're told, oh, you have to come back, because some patients will come in, oh, I thought I was getting my veneers today. No, you're not getting it today, because today we're going to take impression. So depending on what the case may be, each patient is tailored individually. So just get informed about what it is, but this video will break down a little bit of what to expect. So it's not going to be one appointment and you're done. It's going to be multiple. There is time investment involved in getting veneers. Tip number 5, know that every patient is unique. Your mouth, the shape of your mouth, the shape of your teeth is unique. Don't come in thinking that your teeth is going to look exactly like your neighbor's teeth who got veneers last year. And also know that people evolve and time change. What you might like today may be different from what you will like in 5 years. So put all that into consideration. Sometimes you may not need to get a snow white veneers because in 5 years you may not like it anymore. You may think they look fake and you have to do it all over again. So work with your dentist to make sure it's customized to your taste. If you're getting veneers in maybe just your front teeth, make sure it's not a stark difference between that and the rest of your teeth. Make it blend a little bit because you're not trying to scream, hey, this is fake. You're trying to have a beautiful smile. So have that in mind because sometimes I've seen a lot of people, a lot of my patients that maybe they got gold teeth in front of their mouth maybe 10 years ago and now they don't like that gold teeth. And sometimes it's too late because of that gold teeth, a lot of other things have happened to their tooth. So just know that people evolve, people change, our likes and dislikes change. Put that into consideration when making decision. Don't make a decision that is very out there and then in the future you may not like it. When in doubt, get the idea, chew on it for a few days before you commit to something this big. Look up people that have veneers, see what you like, and then ponder on it for a little bit before you make the decision. Remember, the goal is to have something that looks beautiful and natural. So there you have it, your 5 tips. If you're considering veneers or you're about to get veneers, I hope you learned something from this video and I hope you got something that helped you out. Don't forget to share this video, like and follow us and subscribe for more. And until next time, thank you for watching and may God bless you. Bye.